All right, welcome everyone to the Wounded Healers Institute. And today I'm going to talk about what it is that you may want to get out of working with me or the Institute in general. And one of the main features that I think is available is the idea that a healer is a separate profession compared to what the clinician, therapist, um, provider may consider. And so I have academically been arguing for, and I have some of my papers that are in the works that are going to lament this in a way that I think is valid and or deserves, some attention, particularly from a more quantitative mindset. And so I'm looking at how do I, in a sense, market this or sell this in a way that people can connect with it and, understand what they're getting themselves into. And I think that that is the closest thing that it really highlights what it is that we're doing. And what it comes down to is a healer is a separate profession, and that the um, a therapist can be a healer, but usually there are bounds and or more ethical things that are they are bound to, where we are looking at more of a moral code that allows us to be able to um, practice in our own integrity. And when this kind of concept comes from, having worked as a therapist and an EMDR person, particularly, that there comes a point where you start to realize that you have something that can help people that is kind of more of like a surgical tool, namely the reprocessing phases of something like EMDR, which is a trauma-based therapy that helps with moving memories into a new adaptive location, or like storing memories into long-term storage. So this thing that becomes, or this thing that happened can becomes this thing that happened. And so that is the essence of what healing is in a psychological way, but also that memories physically become a part of us, um, is another way of looking at how people, um, how we are organized in general. So looking at how EMDR was, um, how I was trained in it, I see that there was a distinct difference kind of going from, being a person that you who can listen, and to um, somebody who is available to be there, um, for the person. And then EMDR kind of showed that you can do some, you know, active healing. And that had always been a intricate part of who I am. And the path of the wounded healer is for the wounded healer, or the healer, to become, an understanding and informed healer of what that means, whatever their profession. So the way that our training is worked, and or our education really, the way that it works is it is really there for, anybody who wants to learn what healing is, what it isn't, and really how to do it. And, providing the framework for people to be able to help maintain their own healing needs long term, kind of like a gym, kind of keeping yourself available to, the workout, so to speak. So welcome. If you're interested in becoming a healer, those are some of the, outline, a little bit of what it would be like, and why it's there. So thank you.